filling up all your data related to diseases. This is the most important thing that we need to achieve in this week. Then I'm also going to touch upon how to estimate your biological age, and for that give you the format of prescription that is required for getting some lab tests done. Now, although we are going to cover this biological age and the lifespan aspect, longevity aspects uh, towards the end of these 10 weeks, but I want you to get this started right in this week, because it will take a few weeks before you can get the prescriptions and then then actually complete the tests, get the results, and then so this will take a few weeks. That is why I'm going to suggest that to start this week itself. Uh, then we'll quickly round up on what all tasks we are supposed to do in coming weeks. And, then you can actually take the assessment and feedback, etc. So this is the total plan for today's discussion. As usual, my disclaimer stands. I'm going to show the screen every time that I'm not a medical professional, not an AI developer, but just a patient like you. So let's start with creating a baseline. Now, data that AI can use is every kind of data that it can have a look at that, which is very interesting. In the past, as a computer professional, as a software expert, we always had such a big challenge about giving all the data to whatever system we are developing. You see, because a lot of data is not available in a digitized, structured format. Uh, for example, you ask somebody that, okay, uh, what uh, what medicines you are taking, what prescriptions you are having. He will take out a piece of paper. He will take out a piece of paper and show it to you. Maybe handwritten prescription, uh, which will be a
Yeah,
handwritten
there is
prescription.
someone. Yeah, sorry to bother you. I think there is someone muted, unmuted. Can you make me co-host or something like that? Shruti, I can manage this.
Oh yeah, sure. Uh,
Do you
you will
have?
have to tell me. You will have to tell me how to do it. I suppose.
Yeah, Beena ji was muted, unmuted.
Okay. Uh, how do I change you to?
So there are three dots. Yeah,
Yeah.
there you can do it. As a host, you can do it.
Okay, and then here change layout full screen.
Mute and mute. Yeah, that's it.
Uh,
And
where is mute?
now
Back.
it is done. Now she has muted herself. Yeah,
Okay. Okay.
yeah, in between, sorry to bother you, na, so I can take care of this if you want.
Yeah,
And
but how can I give it to you?
so usually when in Zoom meetings, there is an option I give host rights to someone else.
Oh, I see. Oh, it is in Zoom.
Yeah, but here
I'm
also
in
you can
Figure.
give.
Yeah, there
Yeah,
must be something. Okay. Yeah, we'll figure out.
we can figure it out later, but yes, it's okay.
Yeah.
Even I have
Okay.
added my note taker today. Let
Yeah,
us
yeah,
see
you
if
added.
it
Yeah, I
works.
added it. Yes, yes.
So hope it is not disturbing everyone's screen. That is the issue.
Yeah, we
Okay.
can easily minimize it.
Okay.
Are you going
So
to see the screen? Yeah.
yeah, so we have structured data and unstructured data. So I was just telling you that if you ask somebody, okay, what drugs prescriptions you're taking, he doesn't have a digitized form of what drugs you're taking. He will show you some crippled old paper on which handwritten prescription is there, and then converting that means everything somebody has to sit down and feed it into the computer. So uh, that used to be a very big issue, but now the way the AI has evolved, it can take any kind of data. You give data in regular structured form, very good. If you don't have it, just show a picture. It will understand from that. If you give a audio thing, just talk. So somebody is recording, you voice recording or video recording, it will understand that. It can understand any different format of. This is called multimodal. So this multimodal capability of AI is becoming extremely useful. So when you are providing all the data related with your health, either you could have well-structured data available, taken straight from some existing computer systems, like, that is why for hospitals we have this MyChart. So if from MyChart you go and download from there the data, it will already come in a very structured format. If you download data related with your lab tests from some laboratory system like MyCompass, Life Labs, uh, that they have a system called MyCompass. If you use that, you will get very structured information about what tests have been conducted. Uh, so like that, there are places where you would be able to get structured health data, but where you
I
cannot.
know. Sorry, Ashokji, I have a question. Like, I know how to log into my chart and everything and all, but
Yeah.
how to start my own, like, how does AI will do that on my own? Like, I have to tell AI to go to my chart and do it?
Yes. So before you go to for your chat, you can. That is something what we are going to do next week. This week we thought that we'll just uh, check out and tell everyone how to bring all the data, and that data can be in any
Okay.
format. Okay. In the next week, we will be actually showing you that how for the chat you can actually provide all this data and then start asking your questions. Only
Okay.
in that case, chat will be able to give you the correct answers. That's
Okay.
okay. So that is the reason we are actually spending some time here, because this is,
Mm-hmm.
and then there are going to be data which is not available in any system. So for that, we create some questionnaires, and those questionnaires you can fill up those questionnaire, create a PDF document, and that itself can become a. Okay. Uh, Plus, you can create some spreadsheets. I'm giving you some spreadsheet formats also to work upon that. Uh, and then simultaneously, there could be some unstructured data which is available, that also you can just scan and put it into the system. So there can be clinician notes, or there can be some imaging uh, scans, etc. Something of that type. Uh, and anything else that you have, you can just uh, you can just scan that information on your phone or by your camera, and those things can also be fed in. Okay, there are other structured data and unstructured data that would also be subsequently added, but initially we are only looking at this structured and unstructured data which is related with diseases. So this is our first week's concentration. Okay. The next thing is you create a repository for that. So for creating a repository, I have given here a sample of how I have created this repository. Okay, so I'm going to show you quickly. Here is a repository which has all data related with my health. Okay, now of course out of that only some data I've taken here, because I just wanted to give you as a sample of how what you can have. So there is data related with dental, eyes, then lab test results, then uh, from the my chart. Now I had these three major medical conditions: kidney stone operation, prostate hernia, sciatica, stomach. These 3 years I went through these three different major things. So these are all records which are available from hospital management system, which are stored over here. Then there are other things like uh, then the nutrition is one. Then the patient diary. Now these are these are some data which cannot be given, or it is not available in any system anywhere. So this is something I have created a spreadsheet. Okay, now this is a spreadsheet which has day by day a complete diary of what happened, what was the symptom, what exams were conducted, who conducted that diagnosis, what was the treatment given, etc. This is recorded right from Actually, this date is wrong. I mean, of course, because this is just a sample created, uh, but all this record is my actual record, but starting from October, November somewhere, So for complete 6 months record, I was maintaining every day. I was just updating it with what is the latest that is happening. What what symptoms were observed, uh, what was the decision, what was the treatment given, what medication I've taken, etc., etc. Right. So this shows you how we can uh, create additional information which otherwise not available in our regular system. So this is how you can create your complete data repository for health. The next
Ashok,
point I
can
want,
I
yeah, please.
interrupt you?
Yes,
One question.
yes,
So, how can we get the data from our general practitioners? Are they giving us like? I
no,
understand they do not give us the data.
that's correct. We are not getting it from, so that is one area where I think in due course of time they will start giving, but as of now, uh, it's not a common practice. My family physician was very reluctant, so I did not really pursue it further. Uh, so that is why this kind of additional our own record uh, is important to fill those gaps. Uh, and you may not, and even if you don't have actual your family physician's data available, uh, the rest of the data, whatever you can generate with that, you can get started. And I'm
Okay.
sure that we will find a way in which ultimately we will be able to get some data from family physicians. Actually, even now, I mean, they are supposed to give the data, but what they're saying is that they will give you data, but it will be in a paper format. In a so you can probably take some important things you can take in on paper and pay for it. They can charge as much as $5, but typically most doctors are charging about $1 per page. So from your file, maybe you can get some important, maybe 50 pages out of that, uh, get it copied from them, and then those 50 pages. You see, now the advantage of AI is that those 50 pages, if you just scan them into PDF files, that data AI can read. You don't have to actually sit down and key it in like we used to do in the
Yeah.
past.
Yeah.
So that is something you can
Yeah.
consider.
I think the biggest challenge will be to get the data
Yeah,
from all the clinics or the physicians or specialists
absolutely,
that we have consulted, right?
absolutely. But it's a long process. So you get started with it, and what will happen is that as we provide the full data, more the data we feed, our AI doctors, accuracy will increase. Uh, but with whatever you can get started with, you see, if you have some hospitalization records are quite exhaustive, quite complete. So that is one good area to capture the and uh, you get all your uh, medical tests, right? Lab tests that you
Yeah,
get
lab
complete.
tests I have. I
Yeah,
have access because I had
yeah,
paid for that service before getting the test done. So I have record of last few years.
perfect. Yeah,
Yeah, so I can get started with that.
uh,
But Ashokji, I have a question too.
yeah,
What
please.
kind of data we are looking for? All data, say last 20 years, I have the same family physician I go to.
Sure.
So
You see,
what kind of data we are looking for?
more the data related with your health you provide, better it is. AI has no limit to how much data it can take. It can take any amount of data.
Hospitalizations is easy. You can
Yes,
request health records to
right,
provide you with that data. So
right.
that is easy,
Yeah,
hospitalization. But if
yeah,
you don't have any hospitalization, obviously it is not needed.
yeah,
And as
yeah.
somebody just mentioned, getting the lab data is the easiest.
Yes.
Um,
You see,
And
what,
secondly, about the prescription, when I get my prescription, they give me a list of all the medication that I am on.
right.
So is that enough, or do I still need to go to pharmacy?
Uh, if you're getting it from the doctor or directly you're having it with you, no problem. But otherwise, from pharmacy, you can pharmacy. Uh, uh, did you say that you're actually taking your prescription from Walmart? Uh,
I'm not. I have a health-wise pharmacy close to where I live.
okay.
But
And
they do every time I refill, I get my prescription medication. They
yeah,
give me how many are left,
yeah,
and all the information.
yeah. So you can just scan and create PDF documents out of that and feed it to AI. That should be fine.
Okay, thank you.
So
Yeah.
Ashok, it was me who said Walmart and Costco.
Okay. Yeah. Okay. Yeah.
Yeah.
So for you, I don't know. They must be. I mean, they must be 100. They have to have a system for recording all this. Now, uh, they are not sharing it with you.
They are not sharing, but they have their own applications where they have
Yes.
all the record.
So actually, just check out with them to let you know, to tell them that I need it for my AI purposes. So if they would, they must be having a way of giving.
Exporting it. Let me find out. I
Yeah,
will.
try it,
Yeah.
try it. Yes. You tell them that
Yeah,
otherwise I'll have to switch.
yeah, I wanted to ask, like, are we looking for prescriptions on the supplements? Because I do not have any prescriptions on any major issues. It is like only for supplements like vitamin D.
Yeah, yeah.
Um,
No,
yeah.
even that
Not
you should.
general.
Yeah, even supplements you should provide that information to
Okay.
AI, of course.
Okay. So I'll like explore with them if they can export it
Yeah,
and give it to me for analysis.
yeah, perfect, perfect.
Thank you.
Yeah, okay. So compiling all this data, uh, now it has to be kept secured. So that security level actually can be at uh, from very high level to reasonably uh, reasonable level. I would say. I would not say low level. Uh, so if you want to have very secured thing, it is in three different areas the security really gets built in. The one is the data part of it. Second is the compute, that is where actually the your AI engine is going to run, and the network part of it, that is how the data gets transferred from one place to another, right? So uh, as far as data is concerned, the most secured will be if you create your data repository locally on your laptop itself. That can be the most secured way of keeping your repository. The uh, but for convenience, people would actually keep it on a cloud storage like Google Drive or Microsoft OneDrive or some such cloud storage. Now, these cloud storages are also not very. Uh, I mean, yes, it is definitely a little more risky compared to having it locally on your uh, laptop, uh, but uh, these reputed cloud service providers are guaranteeing fairly high level of security. So I think there is no harm in considering keeping your data repository on cloud. Uh, the compute part of it, where the actual, if you are really extremely concerned about the security part of it, you can in fact use a local LLM like this Chinese DeepSeek, which became very famous. And then there are so many versions of open source LLMs which you can actually install on your own machine. Uh, so that can be in case you're really worried about uh, the security part uh, for compute work. But otherwise, chat using Chat GPT, Google Gemini, etc. If you're using any of these LLMs, they're they're good enough. I think security wise, it is good enough. Uh, and then the main thing is about the network part of it. So networks are standard networks, which are like Actually, we use the secured one, HTTPS protocol. So HTTPS protocol is reasonably good secured connection. But of course, if you want most secured connection, then there are options of having encrypted versions of networking, like what WhatsApp uses. WhatsApp uses encrypted versions for transmitting communication. So this can be considered. So I would say that for our all practical purposes, we will use, you can use local data drive, but then once you use ChatGPT or Gemini for actual computing, it will go on cloud. Data will go on cloud anyway, and use the normal HTTPS level security. That should be good enough for our purposes. You don't need to share this data with anybody else, certainly not with us. You don't have to show us any of your data. It's all, it will just show you what to keep, that's all. So starting with what all we're going to connect. So first is My Chart or Pocket Health. These two could be the most. Does anybody require any more explanation on this, or has everybody already tried and used this, or is there anyone who'd like to have more detail? How many of us actually need more
Actually,
detail?
I know how to go through the data and all.
Yeah.
I know we can go through like now they have recently started doing it. Before that, reports we have to
Yeah.
find out the reports we have to upload them. But
Yeah.
my question is that how do you? I mean, मुझे थोड़ी difficult हो रही है मैं कैसे अपना structure बनाऊं?
ये डेटा सेव करने के लिए रिपोजिटरी
नहीं डेटा सेव करके अपना जो हेल्थ असिस्टेंट बनाना है ना पूरा हेल्थ केयर ऐप अपने लिए जो बनाना है
तो अभी तो आप सिर्फ सेव कर लो डेटा पूरा लाके
मेरे पास
अपने
है सारी चीजें ऐसे तो because I
सब
have to
ऑलरेडी
keep
है.
a
Okay, good. If you already have done it, so it's already, you're already ready for it. That is, इसके बाद में how to use it in actual chat GPT, that we are going to see in our next session.
We'll have on personal sessions too, one-to-one, so we can bring up papers and find out how to do it, right?
Certainly.
We are not so much technological savvy, but we know a lot, but still, how to put it together.
This is not too technologically savvy thing, you know.
Okay. Thank you.
Yeah. It's not.
Ashok ji, I want to add something. So when the documents, whatever we get from the prescription or whatever, so it has a OHIP number. So that data we should not, what I think is we should not give it to anyone. So even if you scan AI, we need to block that.
Yeah, so I'm going to show you that, you know, actually AI will be able to help you to completely remove all this, you know. So first you collect all this data, keep it in your local drive, okay, and then we will use AI to remove any personal information from there. It will automatically go replace your name with some funny characters, date of birth, phone number, your social security number, everything else, all such identifiable information will get replaced by something which cannot be seen by everybody else. And how
but
to
still AI also should not see that. That's what I am thinking. Even if we should not give that, so we need to block that, and then we need to scan that PDF or whatever.
What you're saying, even that is feasible, but right now, I mean, right now we are,
because AI will have the history of it, so it will remember, but it's giving us different data, but still it remembers everything, whatever we are giving.
Yeah. We will show you the simple ways of how it can be done, and that will do in our next session. But right now, just bring all the data together and save it on your local drive. That can be one step. If you can achieve that in this week, that will be a great help. That will be a very good start. Okay. So similarly, your this Rexall or this Shoppers Drug Mart, these kind of, from there you can get the prescription information and lab information, etc. So uh, I'm assuming that all this will be quite easy for all of you to do it. Uh, if any of you are having trouble, please ask us. We'll help you one by one, because I think most of us will be able to do it independently. So there is no need to spend time here jointly. Is that okay? Okay, I suppose. Okay, then this is the next part, which you provide manually personal health information, which is not available from your sources where you downloaded data. Okay, so one is you can create these spreadsheets, and the formats for these spreadsheets I'm sharing with you. So if you would go to the uh, repository for which I have given you the links, you see, let me take you to the repository. So you see this repository, sample health repository. I have sent you the link for this uh, repository drive. You can open this. It has data which is actually my data, but you can have a look at it to see what can be given. Out of that, here is this patient diary record. Now here I've given 4 different spreadsheets. You don't need to worry about all 4. Just give this daily health progress thing, and in that daily health progress, you definitely say that how can I keep on giving every day's progress for the last so many years. So don't worry about that. Just put 1 or 2 lines per month, or even 2-3 lines in a year, whatever you remember, you just put it over there, and even that can be good enough as a diary. So what, uh, to basically give your past history about your health records. Okay. In addition, we are also giving you another form, uh, and that is a questionnaire. So this is just like when you go to the go to uh, some medical practitioner, and first, before seeing the doctor, would ask you to fill up a form. So something of that type. I have created one form here. Okay, so on this form you can fill up all your information: name, date of birth, etc., etc. uh, uh, Now, do you have access to digital health records, list of surgeries, past hospitalizations, any persistent pain, sleep quality, digestive issues? There are all different kinds of things are asked in. All this information, if you can fill up and keep it. Actually, this is a uh, automatically fillable form. So you can just open it in. If you open it in uh, Adobe Acrobat format tool, then you will be able to actually type over here your answers, and this becomes an input form for your health.
So we will keep this for ourselves only. Yes, this is for ourselves, for our records.
For yourself, for your records in your laptop, and to be provided to your AI when it is required, and that will be next week.
Okay.
Okay. Then coming back to, so this is the spreadsheet to be filled in, and the questionnaire to be filled in. Okay, these 2 things. With this, you have covered most of the personal data that needs to be. In addition, you may have lots of data which is in different formats, which you think is really very, very important from your health perspective. So there could be some X-rays. There is a vaccine passport. There are some prescriptions, handwritten prescriptions, which you have information about. You have some video recordings, video or audio recordings, which are related with you. Your discussion with some doctor, if you have recorded it over here, you put it. All such things can be added over here. You can give your pictures of what if you want to give some information which you feel it is relevant for your health, then all such information you can put it in one place as your unstructured health data available, and AI will be able to read all of it and make use of it. Okay.
So a quick question: should we also
Yes.
have dental information?
Absolutely, you should have. I mean, it is related. If you are having some dental problems that can be related to you, that can result into some other health issues, right?
विजन भी आईज के लिए भी हो सकता है.
Eyes, absolutely.
Eyes, vision.
Absolutely.
Yeah.
And what I'll suggest is start keeping all things over there. You may not feel the need of that right away, but in due course of now your lifespan is 100 years. You see, you may not be using it at your this age of 30s and 40s. You may not be making use of it, but as you go forward, all that data will become useful for your future years. It will be very useful. Okay. So this next thing, so this is the data that we have to collect. I think everybody has clear understanding of that. Next is I'm offering to meet with you once in 15 days. Our other colleagues could also be, somebody could be available for in-person meeting. What is the general feeling in the group? Would you find it convenient to come to a place like Etobicoke and meet one time, or would you like to have meet somewhere, some different place, or do you feel
we can meet in the library?
Yeah, sure. We
have to book the library in advance. That's it.
Yeah, either we can book a library or one of these temples where all these seniors programs are going on. We can.
Yeah, and more than that, I think if we can book the library for like they have all that computer, digital, everything and all in library.
Yeah,
right?
perfect. Yeah, I agree.
So we can learn that too.
Sure. So, what do you think? I mean, do you feel that this week would be a good time to schedule something of this type, or we can do it a little later, depending upon how you feel the need is. So I think we'll create a poll and get your ideas, and then
I think it's better to give some options. It really depends on what day and time it is, because everyone has to run around for some activities and
correct,
probably coming from work, right? Weekends are convenient, of course, better than weekdays.
Yeah, sure. So we'll set out a poll for this and we'll decide that. Okay, then you are being reached out for checking out what is the status on your homework, etc., and if you require any help. So when somebody calls you, please tell them if you need some hand-holding time, and then the right person will try to connect you with. Okay, so this is it. Then the next thing is, I would like you to get started with some work related with estimation of your biological age. Now, the AI can actually generate the information about what information is required for calculation of his biological age. And I asked I've created with ChatGPT a request letter for my family physician with what all tests I need for my estimation of biological age. Now this is something totally new for the doctors. They will ask you, what is this? What is this biological? Why you want to do that, etc. Right? So I mean, you can understand that this kind of things have never happened before, so they will say that. But what I found very interesting was that actually most of the tests which are required for estimation of biological age are already being taken care by OHIP. OHIP pays for majority of these tests. When the tests are taken for your annual physical checkup, those tests plus a little more is required, for which you have to pay out of pocket. This vitamin D and one or two other tests are you have to actually that doesn't get covered by OHIP. So I had to spend some $139 for getting those additional tests done, and that was good enough for uh, getting this whatever is required for this biological age estimation. Why I'm really suggesting you to take that, this will become your baseline as to how, because this is one place where you are getting one single figure of what level of your health is. So naturally what will happen is that every year when your annual checkup happens, you can do this estimation one more time, and you will come to know that okay, whether this year has been a little better or not. So it is another way of incentivizing us for following up all the right lifestyle options that you have. So that is why I'm suggesting, and this will take for you to actually approach your physician, take his appointment, get the prescription, and then actually take the tests, get the results. All this will take at least 3 weeks. That is why I'm suggesting let's start it right in the first week. Okay, so at this link, you will see the prescription letter, the prescription request, what is generated for me. But a similar one you would be able to generate for yourself using ChatGPT. But it is not necessary. You can just show the letter which is generated for me to your doctor and say that I need something similar. That should be good enough. If not, if this says no, I need it. If you want it actually to be created in your name, then next week when we are going to start working with actual ChatGPT and the other LLMs, at that point of time, then actually we'll generate a letter specifically for you. So that we can do next week. So this is one thing. And then coming to the last thing is your assessment and feedback. There will be the assessment questionnaire will be sent to you. Please fill it up. And here is a complete summary of what all we are expecting you to do. This is quite a lot. Don't worry if you are not been able to do all of it. Try to do whatever, but there are certain things which are really very important that you can do. Make sure that the first thing is on the training side. I mean, you all have been given access to this Google Classroom. I hope everyone here is already. I saw most of the names over there in the classroom, but if there is anyone who has not yet registered for Classroom, please go ahead and become a member. We'll try to actually switch everything completely to this Google Classroom, because that actually makes a lot more sense in terms of keeping track of everybody's progress. Now, we have requested you to install this MyChart application in Google Fit and several other apps. In case you want, there are these online video tutorials are available. For MyChart, there is this 1-minute tutorial available. For Google Fit, there is another tutorial. And I mean, there are so many others. You yourself will be able to very easily find out, go to YouTube and enter the app that you want to install, and you'll get the complete instructions for that. So this is something which you could actually make use of. Then you should subscribe for at least one of these. I suppose all of you must have already done these subscriptions, but we are not telling you to actually pay for it right now. Just take free subscriptions for all of these: ChatGPT, Gemini, Grok, as well as these different apps. Just take free subscription, get started with it, and then when we actually start making use of it, we'll see how much you need out of that, and then accordingly decide whether you should go upgrade yourself to a paid subscription. The another thing that I would like you to start working upon, which is from again next week, is the deep research capabilities that AI provides. And this deep research actually relates with, it is going very deep into one specific area. So what I would like you to consider is one area, and I will give you a whole list of about 15, 20 different areas related with our personal health management. And out of that, you say which area you are really very keen on. Like some of us may be already having some kind of health issues, like diabetes, or heart, or some such problems. Or some of you may not have any health related issue, but you would like to still work upon something like weight management, or something related with your eye care. There could be many things which are actually not a major disease or anything like that, but you would like to do deep research into that. So AI gives you that capability, and this is one of the aspects of AI for health that I would like you to look at, and that I will give you this whole list of deep research topics out of which you select something, or even if you think of something of your own, you're welcome, and select one or two such topics, and then we'll work with you for doing that deep research in that area.
But Ashokji, I think one class in person would be better,
Sure,
because there will be many glitches here and there, and like I know all these things separately, and I've been doing it. Even I know that your biological age, I have done it. PC app, I have done it.
Perfect.
So,
Okay.
like all these things, but I don't know how to put it together on like AI, this thing to create my own.
Yeah, perfect. So we'll definitely do that. Next week we'll start working with this AI chatbots. But creating chats is just first level. Thereafter these topics come in. To do deep research, and then creating the complete workflows, and actually creating an agent. So those things.
How do we create a chart? Like you're saying, create a chart means make your own. Like that AI will help us to create a chart also.
Yeah. So actually, once you provide. Right now, what you get with LLM is a very generalized chat, right? So with your LLM, you can always ask all the questions, but then that needs to be further refined by giving you this additional information, and which that additional information is what you're collecting around, right? So once the chat GPT is also having access to your personal health information, then it will become a chat which is capable of answering questions related with your health itself. That is how. So
I understand that, yeah, but then
so
like
you will start
suppose
seeing that effect. You will start seeing the effect of that by even whatever data you have collected. Once you start feeding it next week, when we in our next session, we'll actually use that, and then you will see immediately some effect of more intelligent answers it will start giving you.
So like suppose whatever disease we have, suppose we have to do diabetes management.
Yeah.
So if we type like in my Perplexity or Gemini, whatever, please give me the details, like how do I frame a question?
So what will happen is that actually you can try it out. Whatever question you are having, if you tell that please tell me what should be my dosage for metformin, okay, my diabetic, and it will rattle out something. It doesn't
No,
know anything about.
I've been using it for a lot of other things, but for medical I haven't used it. For research I've used, and their answers are like perplexity is one of the best one. I don't know whether you have tried or not.
Yeah, I know.
I love that one. That is the best for me.
Yes.
Much better than Google search too.
Yes, that's good. So that deep research is like having your own research assistant. And you tell a research assistant, okay, this is the problem. You do the desk search. Now, what is the desk work that they do? What they will do is that search all the websites and find out where this has been mentioned. Collect all that information together.
Yeah.
Create a summary of that. Now AI will do that for you. Okay. So that's something what we will see in our subsequent sessions, and get started with it in the next week.
Ashokji,
Yes,
for the deep research, say
yes.
I choose weight gain or knee pain.
Yeah.
So which search engine should I be using, Google or ChatGPT?
Yeah, you will ask your AI AI tool what you're using, either ChatGPT or Google Gemini, and in fact there is even way of asking the Gen AI tool to tell it that okay, do the research with Google search.
Okay.
You could even say that.
Okay.
Actually, OpenAI, which actually is the owner of ChatGPT, OpenAI doesn't have its own search engine. Now they're trying to build it, but I mean it's not fully available. ChatGPT can use search engine uh, of Google, or it
Say,
can use Bing, whatever.
for research, we normally use, say, something like PubMed or so.
Yeah.
Can it use those as well?
I have not done that, but I'm sure it can be done.
Okay. And what kind of deep research, whatever suits me or whatever I want, I'm interested in, I can choose that?
Anything. You can do deep research on anything.
Okay.
You'll have to give, just like you would give instruction to a research assistant that I want this research to be done. Go here, get this information, summarize it, do this part. Whatever has come out that from that you do further. The next step should be this, etc., etc. Find out which is the highest occurrence of certain thing in your area, and then whatever is the highest occurrence, do further research on that. Like that, you can actually provide all such instructions of how that research is expected, and it will do that. It's like a full-fledged human research assistant. It's something like that.
Okay.
Okay, so this is training part of it. On the practical assignments, of course, your all devices must. I suppose most of you are able to install all these devices. If not, I mean, let us know and we can work with you to if there is any issue. These My Chart or Pocket Health, these are now you must have it, because if we don't have even this information, then your AI reporting will be very insufficient and maybe inaccurate also. So at least these 2-3 things you definitely get done. Creating structured data, we already talked about it. Filling these sheets and questionnaires already, and this biomarkers lab tested. So this is what is our task for the coming week, and then I just wanted to keep you directed of where ultimately we are going. So our final AI vision is that we will have all this data being captured and a full data repository will be created, and AI agent will generate all such outputs. This is our final goal. Out of which, now in this week, what we are doing is whatever these red boundary things that are shown over here, uh, using these sources, we are going to collect that information, put it in repository, use, and next week when we meet, we'll use this part of using this data and creating some chatbot kind of information out of that. This much we will try to achieve as our step 1 related with digital. This will keep tracking. Week after that or 2 weeks after that, we will have all the fitness related data added to this. So this fitness, Google Fit exercises, that we'll collect information from that, and all that we'll add, and then we'll get some more. We'll also try to do something more on this side, and then after another 1 or 2 weeks, we'll add to that the diet related information, and again do something more. Ultimately, we'll achieve all this at the end of 10 weeks. Okay, so with this, I'm finishing this discussion from my part, and let's see what you would like to discuss. Yeah. Okay. Any questions?
Ashok, I have to hard stop at 8 now.
Sure.
And I'm giving this.
Understand.
Yeah, thank you so much for joining us.
Yeah.
Can we have a quick picture together? We can keep this as a WhatsApp group picture. If we have some
everybody
cameras,
yeah,
I'm not sure
show your
when
camera.
we will meet in person.
Yeah.
Hey, hi Pavni. Tina ji is here. Okay, Anita, can you on your camera for a few seconds, if possible? And who are there?
Yeah, Robin.
We have some members here. Yeah, Robin Deep, happy to see you. I'll give 1 minute to move over and then take a picture. It's good to have faces and stay connected. We have to be staying connected.
Chavi, you are not having your
Yeah,
camera.
Chavi is here. I'm not sure if she's able to on the camera. Okay. Anita, are you able to come? Hi, Chavi.
Hello.
Okay. Anita, are you able to come? I'm waiting for you. Okay, here she goes. She's also working. She's work and colleague like us. Okay, I'm just taking a picture. Eyes closed. I'll take one more. Okay, eyes open. Yes. Ready, steady, go. Okay, I think this is good. I will quickly share in the group also.
Maniji, I was not there.
Yes.
I was sitting on the light.
Yeah.
Okay, no worries. Thank you for joining and staying connected. So yeah, we had a good learning session today. Any questions are welcome. And we'll meet next week.
Anita's picture did not come, I think. She was bending down. You should take again one picture. She was not there.
Oh, okay. I'll do it again.
I know she was doing something.
Okay.
No, Robert,
I was switching on the light, so it was dark and I was closing the blind.
Okay, I'll do it once again. Give me a second. Ready, steady, go. Okay. Oh, Chavi ab aa gayi. Give me a second. Sorry, I'm taking a lot of time in this. Okay. 1, 2, 3. Okay, I think it's good now. Everyone is smiling. Okie dokie. And we'll see when we can meet in person also. Let us see.
स्माइल तो कर ही देना चाहिए, स्माइल करने के पैसे नहीं लगते ना, तालियां बजाने के.
Yes. So yeah, thank you. And anything else, Ashokji and our team members?
But I need help, you know. Frankly speaking, I need help. I understand the concept, but I need little bit guidance step by step initially. Then I'll be able to do it.
No worries. Robindeep is here. She can help you. She can call you whenever you are free.
Yes, Robin, please call me so that we can create. Like, I know I have everything here and there scattered, but I don't know how to put.
No, I believe you are the most intelligent student I have ever
No
seen.
way. No, because I have suffered a lot by this system, and like I'm fighting for last 20 years for my health. And now you cannot do anything because whatever mistake they made, they make a sign and they don't even take responsibility, right?
That's a different story, but I'm talking about continuous learning, that you're very committed. So it's a lot to learn from you.
Yeah, it's very motivational, right? To see everybody working like so.
True, true. No, happy to
No,
help.
because I think everybody is talking about data. Wherever you go, health data, health data. I heard so much this term, so I thought, let me get into it. It is doing it one workshop. They did it now. So they want. There were so many questions there. I said, they're doing. You know, it was really too much. If I have a copy, I would send it to you guys too. So many questions there. So they are having a seminar group discussions on that too.
Yeah.
Yes, yes, please feel free to share any content, any data related to health or the program we are running.
They were general. I mean, it was not a typical city something site. It was general about like how to educate yourself, why should city collect data. Like it was about all the, like it was pretty deep and good. And actually, I liked it.
Good, good. Please share that. Yeah, thank you then.
Thank you.
Thank you, everybody,
for
taking time.
Bye. Thank you.
Thank you. Bye.
Bye.
Thank you, everyone. Take care. Have a good evening.
Good night. Bye-bye.
Good night.
Bye.